Welcome to Adapting Question. Thank you for joining us. So today I want to go over peripheral arterial disease and a chronic venous disease. It's one of the cardiology aspects of your NCLEX. And most of the questions will be straightforward. They're not going to trap you, but you have to understand the difference between them. So we'll go over some key concepts related to this disease. Remember, this is a cardiovascular disease. So when they ask you for risk factors, you should expect that is coming, right? So there's a PAD. This is the peripheral arterial disease, right? That is the way they refer it. So in arterial disease, it's different from, I don't like using the PVD. It's mostly chronic venous. It's a chronic venous disease. And so when you think about think about it that way. Then what do? You just have to figure out what is the difference between them, what are the risk factors, and what are the things you need to know for your NCLEX. So if you're dealing with an arterial problem, there's certain things you have to worry about. Every time you're thinking of something related to the artery, always focus on hypertension. Hypertension, what does it do? It increases pressure in the vessel. An artery carries blood, right? If the pressure in it is too high, it will get to a point you need a lot of pressure to let blood go through that area. So that's number one. Then hyperlipidemia. That means if there's too much cholesterol, you're going to get into trouble. You form plaques in the vessel and it give you issues that blood cannot flow easily. Diabetes also can do that. It make the vessel calcified, it make it thicken, it causes inflammation in the vessel, and that also become a problem. You see what the risk factors I'm talking about? Then smoking. Smoking is the biggest problem when it comes to artery. Most arterial disease is because you smoke. It also causes inflammation, damage to the vessel. These are common risk factors. And of course, age. The older you are, the more your vessels become atherosclerosis and it thicken and it cause problem. The venous disease is mostly, I will explain it to you, chronic venous disease is due to stasis, basically stasis. That means blood is staying in the venous system for too long, and that presents like that. So think about things that will cause stasis. If the vessel is damaged, that's the vein is damaged, yeah, DVT, there will be a bunch of stasis. If you sit in a place for a long time, you don't move, you stand for a long time, right? Prolonged sitting and standing, these are the things that will make the vessel collect too much blood. Any stay there, it causes problem. If you have a risk of forming family history, like if you have a history of making clots, yeah, familial disease that make clots is a problem that can also cause this problem, right? These are little things that you can figure out. So this is what we have. We have our heart sitting like that. It has vessels on top of it. You know, it has four chambers, right? The left ventricle is the main source. He has to push blood out. You push the blood out and you go into your chest. And then you come down, assuming this is your diaphragm, you come down all the way and it goes all the way to your leg. This is the blood supply. All these things I'm talking about, if you have plaques building up here, if the vessel is all thickened, right? It's thickened here. Or if you have you smoke and all the inflammation and you have calcification, all these things make this hole really tight. So blood cannot go through easily. And this is what we have causing peripheral arterial disease. So when I tell you PAD, the major problem is because this vessel blood flow is impeded. And if blood flow is impeded, what will happen? The area that is going to get into trouble is the lower portion of your leg. So the main idea of peripheral arterial disease is what? Less blood flow. That's all. Don't memorize it. Less blood flow. That means blood flow going through every area is diminished. If it's diminished, all your signs and symptoms become easy. Your leg, if there's no blood flow, your skin get cold, right? That's number one. Your pulses is going to go down. So you have decreased pulses. Most of the air in your skin, they need blood supply. If there's a bunch of blood, hey, they're going to grow. They're going to get healthy. If there's not, you have ALS. You see, I'm not memorizing. I'm making sense out of it. The area that is going to suffer from blood is the distal portion, which is your toe. And if there's no blood going to your toe, it dies. So you have ulcers, and ulcers are on your toe. You see how you can make sense out of this, right? These are little few signs and symptoms. You don't have to memorize everything. Whatever they give you, you can make sense out of it, right? You should not expect this person to have edema. Edema is blood supply, too much blood. Therefore, there is less blood going to your leg. Why would somebody with the PAD have edema? So when you see it, it's a trap, right? What do you think is capillary refill? This is what also trap people. When we say capillary refill, that means if I smash your toe or I squeeze it, it turns white. As soon as I let go, it should turn pink. If it take a long time for the capillary to get refilled, it's bad. People with arterial blood supply, when you pinch their nail, it takes a long time. So capillary refill is greater than 2 to 3 seconds. That is bad. It's longer because the blood flow there is decreased. These are a few side effects, signs and symptoms I want you to think about. And then you can make sense out of this easily. Whatever signs and symptoms they give you, I think you figure it out. The venous problem is different. The venous, the leg, this is the leg, okay? There's a valve. This valve prevents blood supply and flow in one direction. So blood from your leg go like that, up. It should not come down. People with the chronic venous disease, the valve is defected so that the valve is now pointing down. So blood goes and comes up and down. So you have reflux of blood. So blood is just basically going to pull in your leg. And then your signs and symptoms are easy. If there's blood is warm, if there's too much blood pulling on my skin, well, my leg is going to get warm. You see what I'm doing? My leg will be warm. If blood stay in my leg for a long time, I'm going to have edema. If blood stay in my leg a long time, the iron in the blood is going to deposit on my skin, and I have browning pigmentation. You see how you can make sense. If blood stay on in my leg for a long time, it's going to cause ulcers. These ulcers will be beefy red ulcers. They are not going to be on my toe. They're going to be above my ankle. So no toe ulcers, but above the ankle. And it's really, really beefy, thick red, right? Your skin is going to be really thick, right? Thick skin. But the skin for the PAD is going to be shiny. So we're going to have a shiny LS skin. This guy is going to be thick. So these is some of the things you have to think about, and you'll be able to figure out signs and symptoms associated with it. I don't have to give you everything, but you can, when you study the NCLEX, I want you to like make sense out of these signs and symptoms. I call it concept. One of the biggest one is capillary refill. There's too much blood in your leg. Therefore, your capillary refill is going to be shorter, right? It's normal. It's less than 2 seconds. And your pulses is going to be +2, normal, right? So we're going to use this information to do some questions, but this is everything you need to know about peripheral arterial disease. There's nothing else, right? There's nothing else you should know except this. The other things I have to know is like oral contraception can cause chronic venous disease due to DVT. But you see what I've simplified? I've simplified the condition, the diagnosis, what you need to know, what are the risk factors, and what are the signs and symptoms associated with it. How much blood is going. So if you know all these signs and symptoms, you'll be able to figure out how to answer questions about it. If there's too much blood, well, your leg is going to have edema. It's going to get warm. There's going to be browning pigmentation. You're going to develop ulcers. Your skin is going to be thick, right? All of them because of too much blood. The opposite is peripheral arterial disease. Don't memorize it. The other thing too is treatment, right? What is the treatment for PAD? I want blood to flow. Therefore, I want you to keep on walking. Walking is number one. So these people would tell them to walk, okay? If they elevate their leg, blood supply decreases. So don't elevate your leg. I want you to keep the leg down. That's the concept. I want you to stop smoking, improve your blood pressure, and you're done. The opposite is chronic venous disease. There's too much blood in your leg. Therefore, elevate your leg. I want you to elevate your leg if you have PVD. So elevate the leg. Okay. Walking too is good, but prolonged standing is bad. I don't want you to do prolonged standing. These are the way you'll be able to teach these individuals what they need to do and how to prevent side effects. So based on what I've told you, let's see if you get some of the concept. A nurse is assessing a client with a peripheral arterial disease. Which of the following clinical manifestations are typically associated with PAD? We already know the content. Which one is associated with PAD? Come out with your content. Use just common sense. I keep on telling you buzzword, right? The buzzword is what? PAD. Therefore, if PAD, the buzzword is the PAD, therefore, what is the major thing? There's less blood flow. If there's less blood flow going to your leg, well, do I expect my skin to be cold? That's the thing. Ask yourself, is my skin going to be cold and pale? Ask yourself, that's the key aspect. Is he going to do this? If I walk, do I have intermittent claudication? Is that what is going to happen to me? Am I going to have browning discoloration on my skin? Is there going to be ulcers on my feet and my toe? Is my pulses going to be strong and bounding? Is my skin going to be thick? And is my pulse +1? Let's take it. This is the vessel. There's less blood flow here. Only tiny blood flow going to my leg. What am I going to see? You're not going to have your skin going to get warm. Your skin is not going to be warm if you have venous disease, so pale skin. Intermittent claudication. When I walk, I'm going to have pain. Browning discoloration, I'm not going to see it because there's less blood flow. There is going to be ulcers on my toe. You see, my pulses is not going to be strong. Why? If there's going to be ulcers and my skin is going to be pale and cold, and I'm going to have intermittent claudication, why will my pulses be strong? You see, it shouldn't be. If I have pulses, then I should have thick nails because my pulses are not that strong. If I have thick nails, that means blood supply is less. Therefore, this is +1. If my pulses is +1, that means there's less blood flow. My capillary refill should not be less than 2.2 to 3 seconds. That means there's a lot of blood going there. You see what I'm trying to show you. So these are some of the things they will put in and they will trap you, but connect them. Cold, pale skin. Therefore, I should have what? Claudication. Therefore, I should have ulcers on my feet. Therefore, my skin should be thick. The nail should be thick, and the pulses should be +1. If the pulses is +2, yeah, then I'm going to have capillary refill like that. This is what is how you put the concept together. So these are your answers. The other ones are all traps. Okay. This is the same thing, but in the venous one. And this is assessing a client with peripheral venous disease. Which of the following are consistent with the PVD? Go with your concept and ask yourself. Don't answer the question. Tell yourself, venous disease. That means blood is staying here. If there's too much blood, my skin is going to get warm. If there's too much blood, there will be pigmentation on my skin. If there's too much blood, I'm going to get ulcers. If there's too much blood, my skin will be warm. If there's too much blood, capillary refill will be less than 2 seconds. So what do you think? This is the same thing. Browny pigmentation, of course, yes, because there's too much blood going there. Ulcers on the medial aspect of your ankle, like I told you, it stay above it, not below. So not on the toe, but above the ankle. Cool skin with poor hair growth. That is the arterial disease. There is less blood. That's why your skin is very cool. That's why hair is not growing. Feeling edema in the leg. Why will you get edema if you have too much blood, right? Pulses is going to be +1. There's no way. There's too much blood flow in your leg. You're not going to have +1 pulses. Now, pain that is relieved by elevating your leg. Think about it. Why would PVD patient have what? Pain that is relieved by elevating the leg, because there's too much blood going to the leg and that gives them pain. So for them, you tell them, hey, elevate your leg. I want you to elevate your leg so that the blood can return back to your heart. So them, this is good for them. History of prolonged standing or varicose vein. If you stand for a long time, blood go to your leg and then you develop ulcers. It's different from PAD. So these two disease process, you should not let the NCLEX deceive you with that. When you see a question, I want you to ace it by thinking about it critically and say, oh, this is what is going on. So these are all venous problem. Okay. Now, this is another one. And this is teaching a client with PAD about managing their condition. Which of the following instructions should the nurse include? Think about it. PAD, less blood flow. Therefore, if the less blood flow, the rest of it has to be related to less blood flow. That is the common sense answer choice, right? Avoid crossing your leg. What do you do when you cross your leg? You're preventing blood flow going to your leg. And you have PAD, and there's less blood flow. Why would you cross your leg? The question says, which instruction should the nurse include? I want you to not to cross your leg. So avoiding crossing your leg is good thing to do. Elevate your leg above your heart while resting. Think about it. If A said, don't cross your leg because there's too much, if you cross, there's less blood. When you elevate your leg, there's going to be less blood. Those answers are dictating each other. You can tell that one is wrong, the other one is not right. This is what I want you to use, buzzwords and common sense, right? This one, if I'm going to cross my leg and it's a problem, then elevating my leg is a bad thing. Therefore, don't elevate your leg. Engage in walking program to improve circulation. I told you walking is the best mechanism to walk. So this is good. Keep your leg in the dependent position. This is like using the same word but changing it. One say elevate your leg. The other one say keep what? Keep your leg in the dependent position. If I keep my leg in the dependent position, more blood goes to my leg. It's good for PAD. If I elevate it, it's bad. Therefore, I got to pick this one. You see? Use a heating pad to keep your feet warm. It's a trap. I know my feet should get warm so that there's blood flow, but PAD cannot have, the feeling is affected, sensation is affected. Therefore, if they put the heating pad on, it's going to burn them and they get ulcers and the wound does not heal. So this look like it sounds great, but it's a wrong answer. So this is your answers. Okay. And this is just to illustrate the whole thing to make sense out of it. And then she's teaching a client about lifestyle changes and intervention for managing PAD, PVD. Which instruction are appropriate for the patient with PAD, PVD, or both? You know, PAD, there's less blood flow. PVD, too much blood flow. Which instruction will you give them? Lifestyle changes. Avoid prolonged sitting and standing. Go to the concept. Who, when you sit and stand, blood go to your leg. So whose problem is it? If you stand, blood goes to your leg. Who should you teach to do that? Is the PVD patient, because too much blood is a problem for them. Wear compression stocking during the day. If you're on the line and you're hearing my voice, this is adaptant class. If you know the answer, you can put it. Who should wear compression stocking? Think about it. Why would I wear compression stocking? To help me as a PAD patient or chronic venous disease? What do you think? Who should do that? Before you select the answer, think about it. What is the purpose of the compression stocking? Just because the answer is there doesn't mean you have to select it, right? Buzzword and common sense. Why would I use compression stocking? Because I want to push blood back to the heart. Who need blood to be pushed back to the heart? PAD does not need blood to be pushed back to the heart. We want to push the blood down to the leg. PVD need blood to be pushed back to the leg. So that's the one you're going to teach to use what? Compression stocking. Who should engage in regular exercise? This one is a trap. Everybody needs exercise, whether you like it or not, whether you have a PAD or PVD, we all need exercise. So both of us. Who should elevate the leg above the level of the heart? It's the same concept. If you elevate your leg, you decrease in blood flow, right? Who should do that? It's like wearing compression stocking, and that is PVD. Who should inspect the feet daily for ulcers or injury? This is risk management. Everybody should inspect their leg, whether you have it or not, so that you don't injure yourself. So these are little things I want you to think about it, and you'll be able to like master this kind of thing. It's not that difficult at all. And the last one, this is basically putting everything together again. Which of the following are risk factors for developing PAD or PVD? You may not know it, but like I said, common sense. Think about it. What is the condition? DVT. Will DVT give you a PAD or a PVD? Think about it. You have blood clots in your leg. It's going to affect your vein. Your vein is not going to work anymore. It causes reflux in your leg, and you have chronic venous disease. Therefore, this is PVD. How about smoking? Smoking usually affects the arterial system. Therefore, this one is PAD. Test taking strategy and common sense. If I have a blood clot in my leg and I give you oral contraception, where do you think it will fall? Oral contraception is the same thing as what? What do you think? If having a blood clot in your leg will give you PVD, therefore taking oral contraception you are more likely to get what? The same thing. PVD is the same thing. What about diabetes? Diabetes affects your artery more than your vein. So this is a peripheral arterial disease problem. Prolonged standing, blood pooling in your leg is like having a DVT. It's like taking oral contraception. Therefore, that one. Hypertension is a peripheral arterial disease, risk factors. I'm using this to teach you because these are the things. You have to know risk factors. You have to know signs and symptoms. You have to know teaching. These are the three things you need to know if you have a problem with peripheral arterial disease and chronic venous disease. Three things. If you need help, check Adapting because I have a bunch of video on that. But three, don't go and take the exams if you don't know what causes PAD or PVD. What are the signs and symptoms you should see? And then how do you teach them to prevent it? The signs and symptoms is what you teach them to prevent it. The same thing. Obesity is mostly what? What do you think? It's a venous problem. Hyperlipidemia is cholesterol. It forms plaque in your leg. Arterial problem. And factor V Laden, it lead to what? Blood clot. So this is a table. If you don't know it, you can take a picture of it, but I want you to know these are risk factors. This is what they're going to ask you, whether a case study, standalone, they're going to ask you the side effect, the signs and symptoms, what are the risk factors, and then how do you teach them? These are Dr. Class. Thank you for watching. Once again, know what is PAD, less blood flow going to your leg. If it's less blood flow, what are the risk factors? Atherosclerosis mostly. Anything that affects your heart going to cause PAD, right? Smoking, hypertension, diabetes, hyperlipidemia. What are the signs and symptoms? If there's less blood flow going to your leg is going to have ulcers. Where would it be? On your toe, right? If you walk, you're going to have pain. If you keep your leg down, it's good. If you elevate your leg, you're going to have pain. Your skin is going to look cold, right? Your hair, your skin also will look what? Shiny. There is not going to be hair on it, right? Therefore, don't put any warm compression on it. You can wear a socks, that is cotton socks to warm you, but don't put any heating pad on. Don't put any lotions in between your toe. These are the things you teach them. Walk until you have pain and continue walking. Claudication. Stop smoking. PVD, too much blood, therefore elevate your leg. Wear compression stocking. Wear it before you get out of bed. What are the risk factors? Anything that causes blood clot. This is Adapting Class. Thank you for watching and good luck in your exams. This content never change. Whether you're taking RN exams or LPN exams, whatever you're taking, it's the same thing. Master your content, apply common sense, focus on your buzzword, and you'll be fine. Take care of yourself and good luck.